Percentage of cases of COVID-19 in the country. Um, as of the 8th of July, our total is at 885 confirmed cases with 670 active and 9 deaths. We witness a very worrying trend in terms of increase in the number of cases, but also a different epidemiological trend when we compare to March, when we confirmed our first case on the 20th of March. During that time, we would go up to a maximum of maybe 4 new cases per day, with a number of days where there will be no reported cases. However, as we came to the end of May, it seems there has not been a single day when we have not reported new cases. And again, that trend has really been escalating quite rapidly. If I look at the last 5 days, we have been on average maybe 20-25 cases a day. On 5 July, there was a reported 18 new cases. However, on the 7th of July, that figure jumped to 53, and yesterday we had 98 new cases added. The trend remains the same, the majority of the cases being imported, particularly now from Republic of South Africa, which itself may be the worst affected country on the African continent right now, and we share a border, the Beitbridge border post with them. Some of the cases are coming from Botswana and some from Europe, particularly the UK and the United States of America, still to a lesser extent Zambia and Mozambique. So having said that, we really need to tighten up our prevention and control measures, even as we also seek to strengthen the case detection and case management capacity. Amid a background of intensified testing, we'll continue to see more new cases, and that calls for very strengthened capacity in terms of infection prevention and control. And today, because of COVID, we now have to talk about infection prevention and control even within the home. And this is really being because some of the pre-symptomatic and asymptomatic COVID-19 confirmed persons will be required to isolate at home. We also need to ensure that we plan now. This is the time to plan for surge capacity in the event that those 10 ventilators or the ICU beds are exceeded in terms of the increasing patient numbers. Where are we going to put the overflow? So we need to plan for that surge capacity right now. And I'm happy to say that the teams are on the ground. We have a team that is in Bulawayo intensifying the surveillance, but also the coordination of the outbreak response. We have had partners that have come on board to support training healthcare workers in infection prevention and control. Admittedly, this has not been much of a discipline. We have had central hospitals where there's just one identifiable IPC trained nurse, but with support from the Infection Control Association of Zimbabwe, there's been quite a number of personnel trained. However, they are not enough for the COVID response. We now require a situation where even the green zone and the red zone of a hospital like Pararingatwa, there is adequate capacity of infection prevention and control in that institution. A case in point is this situation in Bulawayo, where we have more local transmission compared to imported cases. I think out of the cases that they've reported, more than 80, 43 are local transmission. And now we having witnessed the dual outbreak of diarrhea, where they've isolated both Shigella, dysentery, and Salmonella typhi. We now know that the same determinants of poor wash, drive infections, including the SARS-CoV-2, which causes COVID-19. So this is just a reflection that if things are not well in terms of water sanitation and hygiene, then it translates into poor infection prevention and control practices. So we appeal again to ensure that those determinants are addressed so that we can be in front rather than behind this COVID-19 outbreak. Finally, I think I really need to appeal to the citizenry of this country. We have noted a slackening of some of the preventive measures that have been propounded by His Excellency. People are still moving willy-nilly, even when they don't have anything pressing. So I appeal to those that have been given the exemptions to move, to just move and do what you need to do and go back home. So our key message really remains: stay at home. Just go to the shops and come back home. Go to work, do your work, and then come back home. Secondly, we must wash our hands frequently or sanitize them, or both. Thirdly, wear the face mask and wear it properly as long as you are in a public place. Wear it properly. It means cover your nose and mouth with that face mask, so that you protect yourself but you also protect other people around you. So we really appeal to everybody to observe those preventive measures, because our cases are really rising, and we might get to a point where we are really chasing out after this outbreak, so it becomes very untenable. Thank you.